Question 29. Which of the following is the most likely diagnosis? Polyarteritis nodosa, microscopic polyangiitis. Okay, so we know it's another multi-system condition, autoimmune problem. So 37-year-old man presents with generalized fatigue, diffuse abdominal pain, and a mottled rash on his lower legs. No respiratory complaints. His blood pressure is 162/92. Physical exam reveals tender, raised nodules in the thighs and livedo reticularis. Okay, UA reveals trace protein without hematuria. So trace protein, we've got some renal involvement. We got a rash. We got some abdominal pain. Chest x-rays normal. ANCA negative. That's important. Hep B positive. Okay, but there's no Hep B in the answer choices. That would be way too easy. So these types of questions, there's just a lot of rote memorization that's involved in this. Let's see if there's anything we can do based off of minimal knowledge of these conditions to rule things out. I want to start with eosinophilic granulomatosis, EGPA. Anything with eosinophils, unless it's a helminth, is going to be associated with atopy. And I don't believe they mentioned any history of atopy. Again, for the millionth time, it's atopic dermatitis or eczema, asthma, and allergies. Without any signs of those, it's just less likely to be something related to atopy. What about lupus? Everybody knows a little bit about lupus because lupus is everything. If there's not a little bit of everything going on everywhere, it's probably not lupus. Sometimes they'll make it super obvious with a malar rash, which they did not give here. But for lupus, if I'm not seeing any arthralgias, it's probably not lupus. Arthralgias are such a common symptom. Arthralgias, cardiac, neuro, derm, everything. But there's no arthralgias here. I'm a little less inclined to pick it. Next up, we've got our vasculitides, and this is where you say a prayer and let Jesus take the wheel. Takayasu arteritis, commonly, okay, bear with me here. So Takayasu arteritis is named after a Japanese ophthalmologist. If that helps, great. I just wanted to cover my bases so nobody thought I was racist. Takayasu is a Japanese name. Takayasu arteritis commonly affects young Asian women, and it's the pulseless disease. So if you have a young Asian woman or just a young woman in general, because again, they tend to kind of stray away from ethnic correlation nowadays, but definitely pulseless disease, if a young woman presents with barely palpable or not palpable at all pulses, then think Takayasu. This guy doesn't meet the demographic. They didn't mention anything about his pulses, so I'm going to cross that one off. Next up is PAN versus microscopic polyangiitis, or MPA. MPA and GPA are the two conditions associated with ANCA. Without ANCA, then it's probably not MPA. PAN, I remember PAN by the mnemonic, pan everything. So everything got hit by a pan except the lungs. Chest x-ray is normal and no respiratory complaints. Pretty suspicious that I put that in here, huh? So this one is your choice A, pan. Also, it's classically associated with Hep B infection. Another way they could give this to you in the future is to tell you about a history of IV drug abuse. And that might make you think, well, maybe there's Hep B infection and concomitant pan.